Can HRV monitoring help with orthostatic intolerance in chronic fatigue? Heart rate variability monitoring can offer important insights into how the autonomic nervous system functions in people with chronic fatigue syndrome. One common symptom of chronic fatigue syndrome is orthostatic intolerance, which makes it hard to maintain a stable heart rate and blood pressure when standing. Heart rate variability reflects the balance between the sympathetic nervous system, which is responsible for the fight or flight response, and the parasympathetic nervous system, which promotes rest and recovery. Research has shown that abnormalities in heart rate variability are linked to the severity of fatigue and autonomic dysfunction in chronic fatigue syndrome. In individuals with chronic fatigue syndrome, studies have found that heart rate variability parameters are often reduced. This indicates a dysfunction in the autonomic nervous system, showing increased sympathetic activity and decreased parasympathetic modulation. For example, heart rate variability tends to decrease during tests that simulate standing, like head-up tilt testing. This decrease reflects impaired autonomic regulation when a person stands up, and it correlates with symptoms of orthostatic intolerance and fatigue severity. Using heart rate variability monitoring can help objectively assess how well the autonomic system is working and detect the presence and severity of orthostatic intolerance in chronic fatigue syndrome. It can also help track changes over time or in response to different treatments. For instance, some studies have shown that improvements in heart rate variability after specific interventions, such as isometric yoga, are associated with relief from fatigue. This suggests that heart rate variability can reflect meaningful physiological changes that are relevant to managing symptoms. Practically, continuous or repeated heart rate variability monitoring during rest and when standing can help identify abnormal autonomic responses typical of orthostatic intolerance in chronic fatigue syndrome. This information can assist healthcare providers in diagnosing orthostatic intolerance, customizing treatments, and advising patients on how to pace their activities to avoid worsening symptoms. For example, heart rate monitors can help patients stay within safe exertion limits, reducing the risk of post-exertional malaise, which is a common issue for those with chronic fatigue syndrome. In summary, heart rate variability monitoring is a valuable tool for detecting and measuring autonomic dysfunction related to orthostatic intolerance in chronic fatigue syndrome. It provides objective physiological data that correlates with symptom severity and can support clinical evaluation and management. However, it is important to remember that heart rate variability monitoring should be part of a broader medical assessment and not be seen as a replacement for professional diagnosis or treatment. Personalized medical advice is essential for effectively managing chronic fatigue syndrome and its associated symptoms.